Before we start, there is a short announcement from the organizers. This Laureate lecture will be recorded to be uploaded on KOFIH-Tube channel. Welcome to the Laureate lecture of the 15th Dr. Jong-wook Memorial Prize for Public Health. I'm Dr. Hairim Shin, a former WHO VPRO staff member, now retired, and serving as a member of the board member at KOFIH. I appreciate all of you joining us today. Please join me in congratulating once again Dr. Meneses, the laureate of the 15th Dr. Jong-wook Memorial Prize for Public Health. Dr. Meneses. As many of you know, the late Dr. Jong-wook was the fixed Director General of the World Health Organization since 2003, who unfortunately left us in 2006 while preparing for the World Health Assembly. As a dedicated WHO staff member of 23 years, Dr. Lee worked to eradicate leprosy, tuberculosis, and polio and AIDS at the national, regional, and global levels. Some of his remarkable accomplishments include reducing polio incidence to near zero globally and establishing in Geneva headquarters the Strategic Health Operations Center, also known as the SOC room, which played a pivotal role during the COVID-19 pandemic. To uphold his legacy, Dr. Jong-wook Memorial Prize for Public Health was established in 2009 and managed jointly by KOFIH and the WHO. KOFIH is a public agency in the Republic of Korea. Through healthcare assistance project for partner countries, overseas Koreans, and migrant workers in Korea, KOFIH promotes international cooperation and contributes to reducing health inequality globally. Today, we will have the pleasure of listening to the Laureate lecture by Dr. Meneses, and I hope today's Laureate lecture will encourage and inspire those who work for public health around the world. Before his lecture, we have congratulatory messages from honored guests to congratulate Dr. Meneses and today's occasion. First, the Minister Kyoo-Hong, Ministry of Health and Welfare of the Republic of Korea, sends his video message. Video, please.
반갑습니다. 대한민국 보건복지부 장관 조경입니다. 바쁜 일정으로 인해 직접 참석하지 못한 점은 아쉽지만 영상으로나마 이 자리에서 행사의 개최를 축하할 수 있어 무척 기쁘게 생각합니다. 우선 제15회 이종욱 기념 공공보건상의 수상자인 호르헤 프란시스코 메네세스 박사님의 수상을 축하드립니다. 공공보건을 위해 오랜 시간 헌신해온 노력이 공공보건상의 수상으로 더욱 빛을 볼 수 있게 되어 반갑게 생각합니다. 더불어 15회를 맞는 이종욱 기념 공공보건상의 발전을 살펴볼 수 있는 이 수상자 강연 행사의 개최도 진심으로 축하드립니다. 소외된 이들의 건강을 위해 일평생을 헌신한 이종욱 박사님의 정신이 공공보건상을 통해 이어지고 있다는 점 굉장히 자랑스럽게 생각합니다. 이 자리를 만들기 위해 애쓴 국제보건의료재단과 참석을 통해 이 자리를 빛내주신 WHO와 여러 관계자분들께도 다시 한번 감사의 인사를 전합니다. 앞으로도 대한민국은 국제적 위상에 걸맞는 역할과 책임을 수행하고 그를 통해 세계의 공중보건 증진을 위해 노력할 것입니다. 그의 이종욱 기념 공공보건상 그리고 국제보건의료재단이 수행할 역할 역시 기대하겠습니다. 물론 세계보건의 중심인 WHO와의 협력도 빼놓을 수 없으리라 생각합니다. 이 행사를 발판으로 이종욱 기념 공공보건상이 더욱 힘차게 도약하길 바랍니다. 대한민국 보건복지부도 함께 하겠습니다. 감사합니다.
Next, we have the Ambassador Chavez, permanent representative of Guatemala. Will give her congratulatory speech. Let's give her a round of applause.
Thank you very much. Good afternoon. I want to thank the permanent mission of Korea for hosting this event and this happy opportunity to meet. Thank you, Ms. Lee. Dr. Shin, representative of Korea Foundation for International Healthcare. Dr. Edwin Montufer, Vice Minister of Health of Guatemala, and Dr. Jorge Meneses, the Laureate. Ladies and gentlemen, the government of Guatemala feels honored that its proposal for the candidacy of Dr. Jorge Meneses to receive the prize in Dr. Lee Jong-wook's memory has been favorably considered. Dr. Lee Jong-wook devoted his life to the World Health Organization, which he led as Director General, guided by an enormous spirit of service to humanity. There is no doubt that Dr. Lee and Dr. Meneses had similar motivations. We extend our most sincere gratitude to the government and people of the Republic of Korea and Korea Foundation for International Healthcare for awarding Dr. Meneses for his contribution to health management. Allow me to say a few words about the laureate. Dr. Meneses is a Guatemalan physician who held various public positions in health sector, putting his specialty in health services management into practice. During his career, he has supported the participation of the community and civil society in hospital care, an initiative that gave rise to the hospital care and management model that is practiced nationwide, putting the patient at the center of healthcare in its context of family and community. He played a vital role in developing various policies, strategies, and methodologies for the improvement of the performance and quality of patient care services. Some of them are nowadays progressively being replicated at the national and regional level. Like Dr. Lee, Dr. Meneses is a loud voice in favor of the right of every man, woman, and child to have access to quality healthcare services. His career will continue, moved by his personal commitment to the patients, the families, and the communities in favor of those most in need. Congratulations, Dr. Meneses. Thank you very much.
Last but not least, we have the speaker from the WHO, Dr. Suraya Dalil, Director of the WHO Special Program of Primary Health Care based in here, will give words of congratulations. Please welcome her with a big hand.
Thank you very much. Thank you, Dr. Chin. Good afternoon, colleagues, friends, distinguished delegates. It's a pleasure to be here today, and thank you to the Korean Foundation for International Healthcare and the Permanent Mission of Korea for hosting this event. It's a pleasure to be among you, and it's a pleasure to see in person Dr. Jorge Meneses from Guatemala, who has been awarded this morning in the World Health Assembly the award of Dr. Lee Jong-wook Memorial Award for Public Health. As you say, the name of the award is Dr. Lee Jong-wook Memorial Prize, a prize that honors the memories and the impact of Dr. Lee Jong-wook, who was the Director General of the World Health Organization 20 years ago. From the WHO Special Program on Primary Health Care, which is a newly established program by Dr. Tedros, our Director General, we are thrilled to acknowledge Dr. Meneses' lifelong commitment, and I repeat that, lifelong commitment to community health and significant contribution to improving equity, community engagement, and community empowerment. Community empowerment is a pillar in the primary health care. We have heard this week, today, as well as in all the deliberations and statements made in the World Health Assembly, that primary health care is the call of our time, and that universal health coverage cannot be realized without investment in and delivery of primary health care. Primary health care is widely considered as the most effective, efficient, and equitable approach to enhance people's health and well-being. And some of colleagues in this room may ask why this is so effective, efficient, and an equitable approach. And the answer is because primary health care is rooted in equity, human rights, and communities' empowerment. Primary health care is not a new call, nor it's a new strategy or a new concept. But what is new this time is the momentum, is the demand, is the realization of the remarkable importance of the primary health care. Many of you know that the history of primary health care goes to many, many decades ago, to the Declaration of Almata 45 years ago, and the renewed Declaration of Astana 5 years ago. What those declarations outlined is the fact that individuals, families, communities, and people should be actively engaged in the design and delivery of healthcare. That's precisely the approach that Dr. Meneses took when working to promote community participation in hospital care through the establishment of community-based committees. The Continued Performance and Quality Improvement Program, which Dr. Meneses designed and implemented in partnership with Ministry of Health of Guatemala, showcases an outstanding example of action to connect hospital with the community that they serve, to meet people's needs and expectations. And as His Excellency Minister said, to uphold the spirit of the work of Dr. Jong-wook. These efforts for bridging hospitals with the communities and for improving the quality of care were so effective that they have since been scaled up nationwide. Dear friends, ladies and gentlemen, Dr. Meneses' efforts to coordinate Guatemala's first integrated network of health services is an inspiration for other public health leaders and professionals, aiming to improve quality, integrated, people-centered health services to those who need them most. It's a powerful example aligned to primary healthcare principles that found its way to frame the national strategy of integrated health services networks of Guatemala. In fact, it's the only country in Central America to have such a strategy. Dear Dr. Meneses, on behalf of the WHO's Special Program on Primary Health Care, we extend sincere congratulations for your dedication to public health, to community health, and to primary health care. This year, we celebrate the 75th birthday of World Health Organization, and that's why I'm wearing this pen. And there's no better opportunity to recognize health champions and all those who contributed to health for all, such as yourself, Dr. Meneses. You have set an example, and we hope others will follow in your footsteps to enhance equity and health for all through primary health care. Muchas gracias. Thank you very much.
Thank you. Before starting the lecture, we will watch a short video about the Dr. Meneses and his work. Please enjoy.
La medicina para mí dejó de ser solo atender a un paciente. Se convirtió en parte de mi vida y ha servido para que el paciente, su familia y la comunidad se sientan satisfechos al ser atendidos por un médico. Desde el principio, no sé, como decía, esa misma pasión. Yo empecé a estudiar medicina porque a mí me gusta la medicina. O sea, yo no estudié medicina porque fuera una carrera o porque es lo único que puedo estudiar o porque los compañeros se metieron a estudiar medicina, yo también me voy a meter a medicina, ¿va? Sino que al contrario, yo empecé a estudiar medicina porque a mí realmente me gustaba la medicina, ¿no? Entonces, cuando uno trabaja en lo que le gusta, no se siente un trabajo. Mi nombre es Jorge Francisco Meneses, soy médico y cirujano graduado de la Facultad de Medicina de la Universidad de San Carlos de Guatemala en 1982. Inicié mis labores en salud pública desde 1985 y desde esos inicios en el Hospital Nacional de Retalhuleu empecé a notar mi inquietud porque el paciente y su familia participaran en las labores hospitalarias y no solo en la atención de la medicina, no solo en la atención del enfermo. ¿Qué significa eso? Significa que tanto el paciente como su familia tienen acceso a poder decir al hospital qué requieren y cuál es la cartera de servicios que ellos esperan de un hospital. Nos enfocamos en sus costumbres, nos enfocamos en su alimentación que tenían en aquellos rincones más alejados de las ciudades, en áreas rurales. O sea, importante que el hospital, que el paciente, que el médico conozcan las expectativas y las necesidades del paciente. Y en eso se centra el modelo de gestión y atención de hospitales que fue aprobado por un acuerdo ministerial en el año 2009. Pero simultáneamente también a ese proceso que habíamos iniciado de la mejora de la calidad hospitalaria, empecé a involucrarme en el conocimiento de las redes integradas de servicios de salud. Esa estrategia consistía básicamente en asegurar la continuidad de la atención desde la comunidad, desde los servicios de salud del primer nivel hasta el hospital de más alta tecnología. Esa continuidad de la atención es básica para las redes integradas de servicios de salud y lo logramos implementar en la Guatemala Sur. Utilizamos un número único de identificación de pacientes, desarrollamos la historia clínica electrónica, el agendamiento de citas para que el paciente no tenga que llegar a pedir una cita a un servicio de salud. El médico que está atendiendo en cualquier servicio puede agendar ya esa cita al paciente para continuar su atención. Esta estrategia nacional de redes integradas de servicios de salud, denominada ENRIS-G, coloca a Guatemala como el único país en Centroamérica que cuenta con una estrategia de esta naturaleza. Ser médico no es solo atender a un paciente. Ser médico es entregarse a devolverle la salud a la persona. Para mí, Recibir el Premio de Salud Pública 2023 en memoria del Dr. Lee Jong-wook es una gran satisfacción. Lleva atrás una serie de actores que han sido importantes en mi vida. Un apoyo incondicional de mi familia para entregarme a la salud pública en Guatemala. Estoy convencido de que ellos lo ven como un aporte de mi persona hacia la salud. Yo quisiera decirles que sigo siendo salubrista y como nosotros le llamamos en Guatemala, salubrista de corazón.
Estoy sumamente orgulloso de él. De que muchas felicidades.
As you watch it, his work was very touching and inspiring. Now, without further much ado, let me invite the laureate of the 15th Dr. Lee Jong Memorial Prize for Public Health, Dr. Meneses, to take the floor for his lecture. For your information, Dr. Meneses is from Guatemala and speaks Spanish, so his daughter, Lisana Meneses, will interpret in English for us. Thank you, Anna, again. Yeah. Ladies and gentlemen, let's give a warm round of applause to Dr. Meneses.
Muy buenas tardes a todos, distinguidas autoridades. Es un gusto estar con ustedes.
Good afternoon to all the presidents, to the authorities. It's a pleasure to be here with you.
Inicio mi presentación haciendo un recuento de lo que es mi vida y lo que he hecho por la salud pública.
I start my presentation telling you about my trajectory, about on my job in public health.
Soy médico y cirujano, egresado de la Facultad de Ciencias Médicas de la Universidad de San Carlos de Guatemala en 1982.
I'm a doctor and surgeon, graduated from the Faculty of Medicine of the University of San Carlos of Guatemala in 1982.
En 1985 obtuve mi especialización en cirugía oncológica en el Instituto de Cancerología y en el año 2011 la especialización en gerencia de servicios de salud.
In 1985, I obtained my specialization in oncological surgery at the Institute of Cancerology, and in 2011, the specialization in health services management.
Dentro de mi trayectoria profesional, destaca haber laborado como médico del Hospital de Dalil, del cual posteriormente fui director. Fui supervisor de la red hospitalaria en el Ministerio de Salud Pública y Asistencia Social y posteriormente viceministro de Salud encargado de hospitales.
Within my professional career, it stands out that I have worked as a doctor at the Hospital of Dalil, of which I was later director, hospital network supervisor at the Ministry of Health, and later Vice Minister of Health in charge of hospitals.
Además, realicé varios cursos y diplomados sobre gestión hospitalaria, atención integral en VIH-Sida, epidemiología, administración hospitalaria, redes integradas de servicios de salud, entre otros.
In addition, I took several courses and diplomas on hospital management, comprehensive care for HIV/AIDS, epidemiology, hospital administration, integrated health service networks, among others.
Inicié mis labores en salud pública en el año 1985 como cirujano del Hospital de Dalil, Departamento de la República de Guatemala. Desde el principio empecé a apoyar la iniciativa de hospital abierto a la comunidad o hospital sin paredes.
I began my work in public health in 1985 as a surgeon at the Hospital of Retaluleu, Department of the Republic of Guatemala. From the beginning, I began to support the initiative of hospital open to the community or hospital without walls.
Impulsé la creación del comité comunitario, cuya función principal era que el paciente, su familia y la comunidad tuvieran acceso a la atención sanitaria que brinda el hospital y facilitar la participación de la sociedad civil en la atención hospitalaria.
I promoted the creation of the community committee, whose main function was that the patient, his family, and the community had access to the healthcare provided by the hospital and facilitate the participation of civil society in hospital care.
Estas acciones permitieron que la comunidad participara en elegir la cartera de servicios del hospital de acuerdo a sus necesidades de salud, labor que es reconocida por la Asociación de Médicos de Retaluleu.
These actions allowed the community to participate in choosing the hospital's portfolio of services according to their health needs, work that is recognized by the Association of Doctors of Retaluleu.
En el mes de octubre del año 2007, la Asociación de Médicos de Retaluleu me otorga una plaqueta de reconocimiento por 25 años en el ejercicio de la profesión médica, con ética y responsabilidad, destacando mi proyección social en la comunidad retalteca.
Who in October 2007 gave me a recognition for 25 years in exercise of the medical profession with ethics and responsibility, highlighting my social projection in Retaluleu's community.
Como director del Hospital de Retaluleu, este comité se fortaleció y se empezó a aplicar en otros hospitales con apoyo del Ministerio de Salud de aquella época. Finalmente, este proyecto de hospital abierto a la comunidad se convierte en la base para la elaboración del modelo de atención y gestión de hospitales, el cual es aprobado por acuerdo ministerial en el año 2009.
As director of the Hospital of Retaluleu, this committee was strengthened and began to be applied in other hospitals with the support of the Ministry of Health. Finally, this project of hospital open to the community became the basis of the development of the care model and hospital management, which is approved by ministerial agreement in 2009.
El modelo de atención y gestión de hospitales aún se encuentra vigente y es reconocido porque coloca al paciente como la base primordial de la atención y se centra en su familia y en la comunidad.
It is still valid and is recognized because it places the patient at the primary basis of care and focuses on his family and the community.
En el año 2009 fui trasladado a nivel central del Ministerio de Salud, desarrollando labores como supervisor en la red hospitalaria nacional. Como parte de mis funciones fui nombrado como contraparte con USAID para desarrollar la metodología de la mejora continua del desempeño y la calidad, la cual se logró implementar en 13 hospitales de los 46 que forman la red hospitalaria nacional.
In 2009, it was transferred to the central level of Ministry of Health, developing tasks as a supervisor of the national hospital network. As part of my duties, I was appointed as a counterpart with USAID to develop the continuous improvement methodology of performance and quality.
Inicialmente pues se logró la implementación de la metodología en 13 de los 46 hospitales que conforman la red hospitalaria nacional. Esta metodología permite la mejora en la calidad de la atención a los pacientes y se enfoca en la seguridad y en la satisfacción del paciente y su familia.
Initially implemented in 13 hospitals out of 46 that make up the National Hospital Network, this methodology allows for improvement in the quality of patient care and focuses on safety and satisfaction of the patient and their family.
Esta labor siguió durante 9 años, culminando con la aprobación por parte del Ministerio de Salud Pública y Asistencia Social de la política de gestión de la calidad y la elaboración de la estrategia de gestión de la calidad de la cual soy coautor.
This work continued for 9 years, culminating in the approval by the Ministry of Health and Social Assistance of the Health Quality Policy and the preparation of the Quality Management Strategy, of which I am co-author.
Esta estrategia ha permitido que los hospitales destaquen en la mejora continua de la calidad, enfocada en la seguridad del paciente, y ha permitido que la red hospitalaria nacional enfoque la atención sanitaria centrada en el paciente.
This strategy has allowed hospitals to excel the continuous quality improvement, focuses on patients' safety, and has allowed the National Hospital Network to focus on patient-centered healthcare.
Actualmente se continúa utilizando la metodología de mejora continua de la calidad con los lineamientos establecidos en la estrategia de gestión de calidad en los hospitales nacionales y en 7 áreas de salud priorizadas por el programa Crecer Sano, que es impulsado por el viceministro de Salud Montúfar, que está acá presente.
Currently, the continuous quality improvement methodology continues to be used with the guideline established in the quality management strategy in national hospitals and in 7 health areas prioritized by the program Crecer Sano, Grow Healthy, promoted by the Vice Minister of Primary Healthcare.
A partir del año 2016 empecé a incursionar en el tema de redes integradas de servicios de salud, iniciando con el diplomado de RIS impartido por la Organización Panamericana de la Salud, OPS, y luego una serie de cursos y capacitaciones tanto en Guatemala como en otros países.
Starting in 2016, I began to venture into the topic of integrated health services network, starting with the IHSN diploma given by the Pan American Health Organization, and then a series of courses and training both in Guatemala and in other countries.
En el año 2018, el ministro de Salud me nombra como coordinador del plan piloto para la implementación de la red integrada de servicios de salud en el área Guatemala Sur.
In 2018, the Minister of Health appointed me as coordinator of the pilot plan for the implementation of the integrated network of health services in South Guatemala area.
Con este plan piloto se logra implementar la primera RIS en Guatemala, lo cual permitió acercar los servicios de salud hacia las poblaciones menos atendidas, logrando la continuidad de la atención desde la comunidad o servicios de salud del primer nivel de atención hasta servicios de mayor complejidad como hospitales de alta tecnología.
With this pilot plan, it was possible to implement the first IHSN in Guatemala, which made it possible to bring health services closer to the least attended populations, achieving continuity of care from the community of health services of the first level of care to more complex services, like high-tech hospitals.
Para asegurar la continuidad de la atención se desarrollaron e implementaron elementos articuladores de la red.
To ensure continuity of care, articulated elements of the network were developed and implemented.
Estos elementos articuladores, en primer lugar, son los sectores y territorios con población definida y responsables del seguimiento de las acciones de salud.
These articulated elements are the sectors and territories with a defined population and responsible for monitoring health actions.
Además, un sistema de información único para toda la red,
And a single information system for the network.
un número de identificación del paciente estandarizado. En este caso se utilizó el CUI, Código Único de Identificación, que se le asigna en Guatemala a todas las personas desde la inscripción de su nacimiento y permanece invariable hasta su muerte, lo que permitió identificar fácilmente al paciente en todos los servicios de salud.
A standardized patient identification number was used, in this case the UIC, Unique Identification Code, that is assigned in Guatemala to all people from the registration of their birth and remains unchanged until their death, which allows the patient to be easily identified in all health services.
Además, en la Guatemala Sur desarrollamos e implementamos la primera historia clínica electrónica.
It was implemented the first electronic medical record,
El agendamiento de citas electrónico desde cualquier servicio de salud,
electronic appointment scheduling from any health service,
y protocolos de atención unificados en los diferentes niveles de atención y en toda la red.
and unified care protocols at the different levels of care and throughout the network.
La sistematización de los procesos de implementación de la RIS Guatemala Sur y el gran aporte hecho por mi persona al operativizar los elementos claves, todos estos fueron indispensables para emitir la Estrategia Nacional de Redes Integradas de Servicios de Salud de Guatemala en RIS-G.
The systematization of the implementation process of the IHSN South Guatemala and the great contribution of Dr. Meneses in its operationalization were the key elements for the national strategy of integrated networks of health services of Guatemala, RIS, to be issued.
La RIS-G coloca a la República de Guatemala como la única en Centroamérica en contar con una estrategia propia para la implementación de redes integradas de servicios de salud. Situación que llevó al Ministerio de Salud a dar cumplimiento a la estrategia de APS renovada, impulsada por la OPS en el continente americano.
The RIS-G places the Republic of Guatemala as the only one in Central America to have its own strategy for the implementation of integrated health networks, a situation that led the Ministry of Health to comply with the renewed PHC strategy promoted by the PAO in American continent.
En el 2023 se ha avanzado en la implementación de redes integradas de servicios de salud en 7 departamentos de los 22 que conforman la República de Guatemala, como lo son San Marcos, Huehuetenango, Quiché, Sololá, Totonicapán, Alta Verapaz y Chiquimula, utilizando la metodología desarrollada en la RIS-G, del cual soy coautor.
In 2023, progress has been made in the implementation of integrated health services networks in 7 departments of the 22 that make up the Republic of Guatemala, such as San Marcos, Huehuetenango, Quiché, Sololá, Totonicapán, Alta Verapaz, and Chiquimula, using the methodology developed in the RIS, of which I am co-author.
¿Qué esperamos para el año 2023?
what do we expect for the 2023?
Espero seguir brindando asesoría técnica al Ministerio de Salud para la implementación de las RIS, especialmente en las regiones rurales, pobres y desarraigadas de Guatemala, para que de esta manera se puedan acercar los servicios de salud, asegurando la continuidad de la atención a toda la población que actualmente no tiene acceso a la salud.
I hope to continue providing technological advice to the Ministry of Health for the implementation of the IHSN, especially in the rural, poor, and unprotected regions of Guatemala, so that in this way health services can be brought closer, ensuring continuity of care to all the population that currently does not have access to health.
Muchas gracias a todos por su atención.
Thank you very much.